Thanks so much. So Nick and Bryann, we've gone through the same process with you all. Is anything to add or tips or thoughts about what people might think about when they're trying to put screeners like this together?
I know for the team at Jefferson Center, so the trauma systems therapy team, one of the questions that we came up with was around triaging mental health needs with the intention of potentially distributing the PARTNERme assessment prior to meeting. And then VNL was awesome in creating a flag that would email our distribution group if one of the questions came back as a positive. And that question was, are there mental health needs that need to be addressed today? And that was our kind of triage. So I really like that was possible because it really expanded the options that we had on how we were going to be using it.
Awesome. Bryann, this was a long process with your team. Maybe you can talk a bit about it.
Yeah, so I think that we had a lot of challenges in the VA. There are a lot of challenges with data collection in the VA, and so which has nothing to do with VNL, and so we kind of had to work through a lot of those issues, and VNL really helped us a lot through that. And I think that one of the nice things about PARTNERme is that it's very customizable. And so we were, so we could have done this in a number of different ways, because we had PARTNERme, but it was also embedded within a bunch of other, questionnaires that we wanted to know about, related to COVID or related to PTSD and suicide risk. And all those are standardized questionnaires that we can't really change, right? And so we had to figure out a way, how are we going to do these standardized questionnaires and how are we going to do PARTNERme? And so one way we could have done it was we could have just kept all the VNL stuff with VNL, and then we in the VA could have deployed a survey through the VA and done these other questionnaires. So we could have done it like that, but that would have been really challenging for the participant to receive multiple links and really, really hard. And so we were able to come up with a way to take PARTNERme and expand it to include those other questionnaires. And VNL is amazing at working with you on this and helping you through that. And we were able to use the platform very easily, and the support was really great. And so we were able to kind of make it a much easier experience for the veterans to take the survey because of the flexibility of the platform, as well as the VNL team, supporting us in making that kind of survey. And we've done this for another project as well, and it was quite similar, having that input from VNL on, what are the best ways to ask a lot of these social network type questions, and how can we take the other questions that you need to answer that are different from that, and then build it all together in one survey package. So yeah, great experience working with them on that.